Thank you very much.
Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. And obviously my mask is going to get hung on my ear, so I apologize for that. I am going to today give a few brief updates as I typically would, and then I want to speak a little bit more to assurance testing as one of the tools that we have in our toolkit, or we could reference it as a weapon in our arsenal against COVID. And then we'll open it up for questions. In addition to me, Dr. Randolph is here, so either of us can answer questions specifically from the health department. As Dr. Jane said, our numbers continue to go up, and as of today, we have 38,741 cases. Unfortunately, we have lost over 580 individuals to COVID, and we have had an increase of 265 cases in the past 24 hours. We do know over the past week we've averaged over 200 cases per day, and as we all know, our numbers were going up significantly. We've seen a little bit of stability, but I don't want that to be a false sense of security. We are still at a very challenging time. We do anticipate a very difficult fall, and so it's important that we do use every tool that we have or every weapon that we have in our arsenal. We know that masking works. We know that social distancing works. We know specifically here in Shelby County that individuals continue to go about their activities of daily living while they're symptomatic. So staying at home when ill, really with very minor symptoms, is a critical piece. But the assurance testing that was just referenced, as well as the project or program of Test to Protect, is critical in our ability to move forward. I really want to commend Mayor Strickland and Dr. Jane, as well as all of the labs, for focusing locally and building our capacity to be able to do assurance testing locally. Again, this is not being done in many places in the United States, and it's a testament to the commitment within Memphis and Shelby County to serve the constituents here. It's an opportunity for individuals who are asymptomatic and may actually have COVID to get tested. But the critical piece of that is it allows us then to isolate and quarantine those individuals who may pose a risk to the rest of the public. As of today, we have 2,709 people who have active COVID in our community. Those individuals are under isolation, and we have another 8,100 people who are under quarantine. So that means we have well over 10,000 people today who are under a public health order. So the assurance testing allows any business, school, or organization that's participating to know quickly who needs to be excluded from the workplace to reduce ongoing transmission. So we're very proud of Memphis for their leadership here and look forward to working with others to implement assurance testing locally. And with that, I'll open it up for questions.